Hello and welcome to the nation's diplomatic dispatch, a window into global diplomacy and international affairs. Today, we turn to healthcare, a critical issue for ASEAN's future. Now, the pandemic exposed major gaps from supply shortages to unequal access, but it also sparked new ideas for a system that's more digital, inclusive, and sustainable. Now, with healthcare spending still low across the region, the pressure is on to find smarter, more resilient solutions. Now, ahead of the EU-ASEAN Summit or Health Summit in Kuala Lumpur, we speak to Chris Humphrey, Executive Director of the EU-ASEAN Business Council, on how deeper EU-ASEAN collaboration could help shape a future-ready healthcare ecosystem for all. Chris, thank you very much for doing this, and thank you for taking time off your busy schedule to join us on the show right here in Kuala Lumpur at 3 p.m. in the afternoon. Now, I'd like to begin here. Let's start with the big picture. ASEAN countries have very different levels of healthcare development. Where do you see the biggest gaps today with regards to access, affordability, or even infrastructure? Chris?
Thanks, Joe. Thanks for having me on. You're right. This is a vitally important topic for the region. And you're right also, there are very disparate positions on healthcare provision across Southeast Asia. You have highly developed healthcare provision in places like Singapore, in Malaysia, in Thailand, but less good elsewhere in the region. And I think that partly reflects the state of economies. It partly reflects the priorities of governments. Even in countries where you have a high density of hospitals, for instance, you perhaps don't have the same quality of care that you get in some of the other markets in the region. And that is, I think, a lot because governments haven't paid enough attention to healthcare. It's not been prioritized enough. Expenditure in terms of GDP on healthcare as a percentage is pretty low, especially compared to places like Europe. There's a whole multitude of factors that need to be addressed. And you mentioned the pandemic just now. I think the pandemic really did heighten or highlights the differences that do exist in the region.
Now, healthcare spending in ASEAN remains low. How do you convince governments and businesses that investing more now will save costs in the long run? But to just backtrack a little bit also, just after the great lockdown, what were some of the major gaps you saw at that point, just as we came in out of the lockdown? Chris?
Well, I think let's go back to the lockdown period. The differences we saw was most countries, and it wasn't just here in Southeast Asia, actually, it's throughout the world, most countries weren't ready to handle a pandemic of that scale. The number of people who thought they required hospital care, who were seeking out primary care from GPs, from clinics, and from hospitals. There were also then, of course, supply chain deficiencies. You know, we were struggling everywhere to get our hands on PPE, on masks, on gloves, on everything else, because people just weren't expecting that level of requirement. I think that was a major lesson for all governments. You know, here in ASEAN, where they did collaborate and cooperate, they talked about having emergency stores in place that they could all draw upon. They were some of the lessons that we were all learning. I think what it did highlight, actually, and the question you're asking is how do we increase expenditure? Well, I think we would argue, yes, you need to increase expenditure, but you also need to look at better ways of how you're spending your money, and sustainable healthcare financing is a key theme for us. And one way actually is you need to do more on prevention. We need to teach people how to look after themselves better. So there's less of a call in the primary healthcare system, and those that do need treatment can actually then get the treatment.
So you're talking about preventative healthcare, how we can tell people stopping it or working on it before it happens. But I guess one of the problems, and I'm speaking in general now with regards to how we think here in Asia, I guess we're always looking for a silver bullet for healthcare, and preventive healthcare is something we don't like talking about, especially me as a Malaysian. I'm always looking for the best doctor to help me with my problem, but not seeing how I can work on preventing myself from getting into a problem. And I think it's a general mindset that we have. Your thoughts, please.
It is a general mindset, and I'm probably the worst at preaching it. I'm definitely a case of don't do as I do, but do as I say. And I love my nasi lemak in the morning like everybody else does in the region. We need to change mindsets, and we need to teach people about the importance of slightly healthier living. And learn about your bodies more, look out for the signs when your bodies are telling you something's not quite right, so it can be caught earlier. There are several levels of prevention when it comes to it. Part of it starts with us. It starts with our food, it starts with our exercise, it starts with how we live our lives. Making sure actually we learn to relax and rest when our bodies are telling us to learn to want to relax and rest. But it also comes around to perhaps early detection as well. And there are a number of things that can happen on that side. If we detect problems earlier, they're quicker to treat, they're cheaper to treat, and then we as people can get back to work and contributing more to the economy.
Right. Now going back to, or rather moving forward and looking into an EU-ASEAN collaboration geopolitically, a lot of these terms are bad words these days, but if you talk about EU-ASEAN collaboration, what specific lessons from EU healthcare systems could ASEAN countries adopt quickly and effectively at this point? And I also say this knowing full well that a lot of people are already talking about us being prepped or preparing for the next big pandemic.
Yes, and I think we all need to prepare for the next big pandemic because it will happen at some point and we just don't know when it's going to happen. I think if we went back to COVID-19, during that period, there was a lot of collaboration between health authorities in Europe and health authorities here in Southeast Asia, between the European Commission and between ASEAN and institutions. A lot of information sharing, a lot of work being done on monitoring the progress of the disease, how it was being transmitted, and a lot of practical assistance in terms of assistance for vaccines and assistance for equipment as well. And then as we were coming out of the pandemic, a lot of work being done on just tracing where it was heading to and what it was then beginning to look like. That sort of stuff can continue. If we're talking about pandemic preparedness in the future, sharing ideas, sharing monitoring of current disease patterns for certain viruses, that should continue. If we're talking about the bigger picture, we have very different healthcare models here in Southeast Asia compared to what Europe has. Europe has often a state-funded universal healthcare system. You think of the UK's NHS as an example of that. Here we tend to have a lot more of a mixed between part state-funded, part out-of-pocket, part insurance as well. But there are lessons that can be learned, and I think the lessons are Europe now puts a heavier emphasis on prevention and a heavier emphasis on early diagnostics as well. And I think that's the route that ASEAN needs to go down. If we carry on with the current paradigm within Southeast Asia, healthcare will become unaffordable for governments.
Mm-hmm. I mean, healthcare is already unaffordable for the people. Now we're looking at governments struggling or trying to think as to how they can move forward. But having said that, just going back to this EU-ASEAN collaboration, with what you've said, what would be one thing that we could start when it comes to a sort of a collaboration? We know we have different models and the NHS is very different from what we have here, and also as to what we see in South America and North America. But what is that one thing we can, if EU has a good model, what can we pick from there now, which we can kickstart straight away?
Greater involvement,
fruit, so to speak. Yeah.
I think greater involvement of the private sector. Let's get the private sector more involved. The private sector has a lot of expertise, a lot of knowledge, not just in practical terms like running hospitals, but knowledge about how to do prevention, how to do healthcare literacy, how to work on new innovative treatments as well. And I think just involving us more in part of that discussion and getting the private sector to work alongside governments to deliver better healthcare services.
Mm-hmm. Now, when you talk about facilitating public-private partnerships in healthcare, can you tell us of a success story that you've seen, I mean, recently, or with all the research you've done, or the reading and also observation you've put in place so far?
Yeah, I can tell you about what our members would like to do and what they have done in other parts of the world. And it covers multiple different areas of the healthcare continuum. But part of it is partnering with health authorities, running prevention campaigns, running campaigns about self-care, so better nutrition, better exercise, what to do if you've got a slight sniffle, which isn't, by the way, go to the GP, it's fine self-care. It's working with governments on developing life course immunization programs. We all remember, our kids need to get their vaccines done when they're very, very young. But we as adults, we still need like a flu vaccine every year. Flu is just not a cold weather problem. It's a problem here in the tropics as well. So working on programs around life course immunization. And then I think things like tackling NCDs, and NCDs are the biggest problem perhaps here in Southeast Asia, with cardiovascular problems, issues related to obesity and diabetes, etc. Again, we have companies, we have members who are ready and willing to work with ASEAN governments on developing education programs and developing new ways of getting treatments out to patients. And they're things they've done elsewhere in the world.
Now, when you take a look at what's happening, and I like to bring it back to Malaysia and what happens here in Malaysia. If you take a look at the private healthcare service or private healthcare systems, a lot of people are taking money out of their own pockets now, knowing full well that insurance companies can't handle it or don't want to handle some problems. People don't read the fine print. There's so much of fine print we don't read through, and we're all caught in a heaping mess when it comes to sorting out your problems. Just say you go into a private hospital for 5 days for something like pneumonia, you're out with a bill of 10,000 ringgit, and to the average Malaysian, 10,000 ringgit is a lot. And I'd like to go back to what you're talking about. I'd like to go back to a public-private partnership. Now, the government in Malaysia is also looking at a blanket sort of insurance coverage for everyone. How do you see this playing out?
I think, again, I'll go back to the point of public-private partnerships. There is a role for insurance companies to play, either in providing you with a comprehensive healthcare insurance that can get pricey, and you're right, it can be fraught with difficulties in terms of what's covered and not covered. But there are examples there of insurance companies providing very tailored health insurance support for covering particular diseases, for particular communities. But this needs to be done hand in hand with whatever the Malaysian government or the government anywhere in the region is looking to do. Essentially, it's a term used when it comes to financing infrastructure, but a blended finance model is the sort of thing you may want to be looking at in this area. So yes, you have some insurance coverage, which is cheaper, by the way, than paying directly out your pocket, but the government will need to provide some basic level of coverage as well.
Right. If you're just joining us on the program, this is the Nation Diplomatic Dispatch, and we're currently speaking to Chris Humphrey, the Executive Director of the EU-ASEAN Business Council, joining us via Zoom in Kuala Lumpur. Also, I'd like to talk about other things which we are looking at, especially Malaysia and the region is looking at. We want to talk about digitalization, and that's moving in a very big way, digital health. We'll take a quick break. We'll come back and delve into digital health and prevention and how we can move in that direction. Thank you very much, Chris, for joining us. We'll take a short break and come back and continue this conversation.
Impian aku, cita-cita aku. Pelbagai cabaran, bermacam dugaan. Mustahil, lupakan saja. Seperti mereka, semakin sulit perjuangan itu, semakin indah saat kemenangannya. Impian aku, cita-cita aku. Aku boleh. Kenapa? Untuk siapa? Di sebalik setiap kemenangan ialah sebuah negara yang bangga dan bersatu padu. Semua ini untuk kita. Siapa kita? Kita.
Thank you very much for staying with us right here on the Nation's Diplomatic Dispatch. We're currently speaking to Chris Humphrey, the Executive Director of the EU-ASEAN Business Council. Chris, I'd like to come back to our conversation. You want to talk a lot about prevention today, and when we talk about prevention, we also need to meld that with digital health, and I'd like to meld that digital health and prevention together. How ready is ASEAN realistically for a digital health transformation? What are the challenges, of course, infrastructure and digital literacy or trust problems we have in that area?
They are all problems. Let's just step back a couple of years, back to COVID-19, and suddenly you wanted to consult a doctor. It was done over Zoom or Teams or other video systems. A lot of people were then using apps on their phone to try and monitor their health. That, I think, kick-started a bit of a revolution for digitalization of healthcare. Now, we live in a region which is very diverse. Not everyone has immediate access to a doctor. There are a lot of remote rural communities across Southeast Asia. Digital health provision can make a huge difference to their lives. We do need to change some rules and regulations in some parts of the region, but we also need to teach people how to do it. Now, a lot of us, I'm wearing a Fitbit, so I'm monitoring my heart rate, my O2 levels in my blood, etc., etc. And many people have smartphones which come with inbuilt apps to help you monitor your health. We should make greater use of those. But we shouldn't be afraid either of having things like e-pharmacies, particularly if you don't live in a city, you can't access a pharmacy very easily. Having an e-pharmacy, having it delivered to your doorstep, that's one way of looking at it. Remote consultations with doctors as well. You can do a lot over a video call. It's not the same as putting the stethoscope perhaps on your chest, but with applications on your phone, the doctor can get an idea of your blood pressure, your heart rate, etc. as well. So doing a lot more, I think, on digital is one way out, and it's certainly a way of delivering better healthcare to more remote rural communities.
Now, I guess when you talk about digital literacy and if we look at what's happened to the world and AI and how AI is, giving us so much information, it's taking away the drudgery for fogies my age in doing what we do, but it also gives you a lot more information as to what you need to know about your health. Say for these days, I understand that I need to know my blood sugar levels, I need to know my levels of cholesterol. I also need to understand what my hemoglobin is. Back then, no one took this into account. If you're a woman, this is very important to you, knowing that your hemoglobin is 13. If it's in fact anything lower than that, you might be anemic. So does this mean that now the whole medical fraternity, has this upped the ante for the medical fraternity to up their services, especially with doctors?
I think one thing it's done, AI in particular, by the way, I'm an old fogey like you, but AI in particular, I think provides a great tool, and we can use it as human beings, and we can put in how we're feeling, what our symptoms are, and it will then start telling us some answers. I think the great thing about what you were mentioning just now, some of these tests are now actually more readily available. And I think the more readily available we make them to people, the more they can monitor their own conditions. They're not going to go in trouble with their GP for a test, and they can just see how things are going out, and then perhaps maybe have a televideo conference with a physician when they say, my results are now troubling me. And that's then a lot quicker and a lot easier. I think what it does mean, it's making healthcare become more accessible to people generally. And I think that then means it's demystifying parts of it. And the end result of that is, I think the healthcare practitioners do need to raise the game more, because people start to increase understanding and they can start questioning more about the treatments that they are getting. So to answer your question, yes, I think it will mean a raising of standards, but it also means that it's becoming more accessible to people, and that can only be a good thing.
Mm-hmm. Now, moving from reactive to proactive healthcare sounds great, but how do we get both governments and the public to prioritize prevention over cure? I know you talked about this earlier, but I'd like to just go back to that, because I think we should try to bring this message in that preventive healthcare is the more important part about healthcare.
We would say it's the most important part about healthcare. We live in a region that we all think is pretty young, and today it is pretty young in most countries, if you set aside Thailand and Singapore. but it's a region which is rapidly aging, and it won't take too long until Southeast Asia collectively is classed as an aged society. We need to prepare the ground now for that. And that's what I was saying earlier. Healthcare will become unaffordable for governments and for people unless we start to take action now. And that means diverting some resources away from actual care, curative care, towards prevention. Because if we prevent, that is the best thing. If you stop people getting sick in the first place, you don't need to go and see a doctor or a nurse or a clinic or go and have surgery. And you can then leave the hospitals there for the people that really do need it, the people that really are sick. Now, part of this is it's education. And it's not just ministries of health involved in this discussion. It's ministries of finance, and it is ministries of education, and it's ministries of culture and youth and everything else. Because it starts with education. It starts education at school. It starts with educating the parents and the grandparents about what's good and what's not good, what we should eat, what we shouldn't eat, when we should exercise, etc., etc. Because that's the first line of defense. The next part is, I have a sniffle, I have a cough, I have a sore throat. Well, you don't actually need to go and see a GP. Often going to see your local pharmacy, getting some over-the-counter medicines will be perfectly adequate for treating that. But it's also education about when that's not succeeding, at which point do I need to actually go and see the doctor as well. All of that is an education program. We can also do a lot more in terms of prevention in enabling people to have access to over-the-counter medicines, because again, that stops them having to go to a GP clinic and get a prescription. It becomes cheaper for them, and they can get some basic health care like cough syrups or headache tablets or painkillers or whatever it is, lotions for bites and things like that, over the counter at a chemist or a pharmacy. Again, you're improving access for everybody, but you're reducing the amount of strain that's happening then on the healthcare system. That enables ministries of health and ministries of finance to direct the rest of the money towards the care where it's really, really needed.
Now, with Malaysia sitting on the chair of the chairmanship of ASEAN, and Malaysia talking about a blanket insurance coverage that's needed for the country, how optimistic is it for us to look at something that can cover all of ASEAN? Is that a doable model? Is that something that will work? Financing or insurance models that could work for all of ASEAN?
There are certainly ASEAN-wide health objectives under the ASEAN health clusters. I don't think we're looking at an ASEAN-wide system of health insurance or an ASEAN-wide system of healthcare provision. That's many, many years away. But we are looking at ways in which they can collaborate with each other, learn more from each other, see best practice in another ASEAN country, maybe look to develop it themselves in their own country. I think if I was looking at Malaysia, the health system's not too bad, but it could certainly be better. Then we need to find a way to handle the costs of it. And I mentioned earlier, that's going to be a multifaceted approach. It's part government funding, it's part private insurance, it's part out of pocket. It's part also the government looking at how it's spending its money and can it spend it more efficiently and more wisely as well. So there's a multitude of different factors to look at. But I think it's a long way away from having an ASEAN-wide system which mirrors any one of the ASEAN countries.
Right. Before I let you go, we've got a couple of minutes left, Chris. Maybe your closing thoughts on what we've been talking about, and what would be your takeaway for all of us watching this program today?
I think the key one is health starts with us. It starts with us at home. It starts with how we look after ourselves. It also should involve that we should go and get regular checkups. And if we have a problem, early diagnosis is much better than leaving it too late, because too late costs money, you get sicker, it's a bigger drain on governments. But there's a role for everybody to play in this. And I think this is a whole of society question. It's not just ministries of health. It is private sector firms, the pharmaceutical firms, the diagnostic firms, the self-care companies. It's the medical profession. It's the ministries of health and ministries of finance and education, and organizations such as ourselves. We all need to work together to try and deliver a better, more sustainable healthcare system for the region.
Thank you very much. Chris Humphrey, the Executive Director of the EU-ASEAN Business Council, joining us right here on the Nation Diplomatic Dispatch. We look forward to seeing how this partnership continues to evolve and shape the future of healthcare in ASEAN. I'm Jared Ratnam, and this has been the Diplomatic Dispatch on Bernama TV, your window into the world of diplomacy and international affairs. For more, head to bernama.com. See you for now. Take care. Bye-bye.
Tahun 2025 tahun yang penting bagi Malaysia dalam tempoh kepengerusian ASEAN, kerana ini masanya untuk kita bukan sahaja memantapkan kerjasama politik dan ekonomi tetapi juga memacu transformasi digital serantau. Apa fokus Malaysia dari kecerdasan buatan